Hi everyone, Richard here. Welcome to Pain Management 101. Pain is defined as suffering or discomfort caused by illness or injury. Everyone experiences pain differently, which can make it difficult to define and treat. Pain is the body's way of telling us there is something wrong and plays an important role to protect us from harmful situations. For example, when you touch something hot, our brain reacts quickly to signal us to a danger. Chronic pain, however, can be debilitating and reduce our quality of life. Some common terms used to describe pain include aching, burning, dull, stabbing, shooting, tingling, sharp, and throbbing. The most common causes of pain include muscle pain, tension, stress, overuse, and minor injuries. There are two main categories of pain: tissue damage or visceral pain, and nerve damage or neuropathic pain. Visceral pain occurs when organs, muscles, or tissues are inflamed, damaged, or injured. Some examples of visceral pain include appendicitis, gallstones, chronic chest pain, diverticulitis, and pelvic pain. Neuropathic pain is caused by nerve damage. There are many causes of neuropathic pain. A few examples include diabetes, herniated discs, arthritis, spinal cord compression, and multiple sclerosis. How our body registers pain. 1. Sensory receptors send messages through nerve fibers to the spinal cord and brainstem. 2. The brain receives a message regarding where the pain is being felt. 3. In response to pain, the brain releases chemicals called endorphins, which are morphine-like substances. Pain research has discovered brain activity changes in response to acute versus chronic pain. This discovery might explain why treatments of acute pain aren't always effective for treating chronic pain. Acute pain is relatively more sharp and severe, and typically lasts less than 3 to 6 months, and is related to soft tissue damage. Chronic pain lasts beyond 6 months, and the nerve signals continue firing even after you've healed. Oftentimes, chronic pain occurs without an obvious cause. For some, chronic pain is the consequence of an injury or health condition. Some well-known causes of chronic pain include past injuries or surgeries, back problems, migraines and other headaches, arthritis, nerve damage, infections, and fibromyalgia. Symptoms range from mild to severe and have been associated with a dull ache, throbbing, burning, shooting, squeezing, stinging, soreness, and stiffness. The main goal of chronic pain treatment is pain reduction, as chronic pain can be debilitating and often cause daily activity disruption. Thankfully, there are natural solutions available for those not comfortable with medication and surgery. Natural solutions for pain management include electrical stimulation, massage, and acupuncture. Electrical muscle stimulation is used to reduce inflammation, decrease muscle spasms, and relieve pain. During this process, electrodes are transmitted through pads that adhere to the skin. Light electrical pulses trigger muscles to contract, mimicking the action potential that comes from the central nervous system. Massage is used to improve circulation, reduce swelling and inflammation associated with the pain, and encourage quicker healing. Acupuncture is a form of alternative medicine, and specially trained practitioners may incorporate the treatment of acupuncture. For those not familiar, acupuncture is a form of traditional Chinese therapy, involving the insertion of thin needles into the acupuncture points of the body. The needles increase blood flow and help relieve pain. Many patients report feeling very relaxed during sessions. Self-management techniques allow individuals to become an active participant in his or her pain treatment. Research shows self-management programs have reduced many barriers to effective pain management, helping individuals to significantly increase their ability to cope with pain. The best self-management programs help by teaching individuals various methods of thinking about and responding to pain, thus making their actions to alleviate pain more effective. Experts have identified a number of key tasks to aid in self-management of chronic pain. These tasks include building a partnership with your healthcare provider, using medications appropriately, applying cognitive and behavioural strategies, getting help with emotional consequences of chronic pain. For the best results, talk with your healthcare provider, as they are there to answer questions, help address barriers, and encourage self-management efforts. Individuals suffering from chronic pain face many daily challenges. While pain is a huge factor, other challenges include managing symptoms, modifying responsibilities, and coping with the negative emotional consequences. Many chronic pain sufferers struggle with no longer having full control over their own life, having to rely on others to help with even mundane tasks. This is why self-management aims to help individuals regain some element of control. Learning how to keep pain from dictating daily activities is what self-management is all about. A number of techniques have been identified as helpful tools when learning self-management techniques to help chronic pain sufferers gain control of their day. These include effective pacing, food choices, physical activity, easing tension, sleeping better, focus, positive thoughts, and ergonomics. Let's discuss each of these techniques further. Many chronic pain sufferers refer to good days and bad days. As pain can be so debilitating on bad days, individuals tend to overwork themselves on good days in an attempt to catch up on activities that were missed on bad days. This often leads to needing more recovery time following a good day. Pacing is the difference between doing too many activities and not enough. Rather than doing everything on a good day, break up activities so you, not the pain, are in charge of how you plan, start, stop, and change what you're doing. Some effective examples include setting rest breaks to break up tasks, frequently changing the task to limit repetitive movements, and simply working slower. Food is one thing everyone can control. This is very good news, as what we eat and drink throughout the day impacts overall health and wellness. Constipation is a common side effect of medications. Getting plenty of fibre and water daily can help manage this annoyance. Limit your intake of soda, tea, and coffee. Eating regularly will help keep energy levels up. Well-balanced meals will help your body heal and help the effectiveness of some medications. Make sure to talk with your doctor or pharmacist to learn about any foods that should not be consumed with specific medications. Regular physical activity can help improve the body's strength, flexibility, and endurance. Chronic pain can lead sufferers to rest more frequently, which can negatively impact muscle mass and increase disability. Low-impact activities are ideal. Even 10-minute sessions a few times throughout the day can help improve overall well-being and reduce your risk of long-term disability. Some exercises to try are cycling, walking, swimming, yoga, and Tai Chi. For most people, physical activity with a friend is more enjoyable than going at it alone. Try looking for meetup groups or classes offered in your area. When exercising at home, turn on your favourite music or TV show to help pass the time. As stress levels increase, tension increases as well, often leading to increased pain. Finding techniques to help stress and tension will help you feel more relaxed. We stress for many different reasons: frustration, worry, fear. The options are endless. Managing stress can help develop a more positive outlook. Meditation is a wonderful mindfulness technique for slowing down and focusing on your breath, which, in turn, helps alleviate worrying about past or future events. A number of benefits are associated with regular meditation, including reduced stress, anxiety control, positive emotional health, enhancing self-awareness, sleep improvement, and helping control pain. Lack of sleep leads to fatigue, irritability, stress and tension, all of which make it harder to cope with pain. Depression, sleeping too late, napping, and resting in bed contribute to sleep disturbances. There are a number of things you can employ for a better night's sleep. Use your bed only for sleep. Avoid watching TV or other activities in bed. Make your bedroom peaceful, keep it tidy and clutter-free. Set up a nighttime routine, such as taking a warm bath before bed, listening to some relaxing music, reading a favourite book, and doing some stretching. Avoid eating large meals right before bed, and avoid eating or drinking anything with sugar or caffeine. Many people report their perception of pain changes according to what they are focused on. When pain occupies most of your thoughts, pain can become amplified. Changing your focus to a hobby, reading a good book, watching a favourite TV show, or engaging in an interesting conversation can help distract the mind away from pain. Brain research shows specific areas of the brain which are active during pain. These same parts of the brain show lower activity when our attention is directed to something else during episodes of pain. Redirecting focus during a pain episode can be particularly difficult. However, with practice, it will become more natural. The more you are able to fill your conscious awareness with other, more enjoyable things to focus on, the easier changing your focus will become over time. Challenge your assumptions that being productive or happy is not possible with pain. Once you understand that pain can be influenced by your thoughts, you can take back control over your pain. Cognitive behavioral therapy has been identified as a method for managing pain. This form of therapy aids people in developing skills to alter negative thoughts. By changing negative thoughts and attitudes, you can change your awareness of pain and develop coping skills. In clinical trials, cognitive behavioral therapy has been shown to alter the physical response in the brain by reducing stress. Stress levels affect norepinephrine and serotonin, which are powerful pain-controlling chemicals. By reducing the release of these chemicals through the way you think about pain, the body's natural pain relief response can be made more powerful. Ergonomics is a science of refining the design of products to optimize them for human use. The goal of ergonomics is to minimize the risk of injury when doing certain tasks or using tools. Applying ergonomics in your daily activities can be as simple as improving your posture while sitting or standing. Being mindful of the way you might lift, reach for, or move objects can help minimize the risk of injury during tasks. Many office settings offer ergonomic tips or tools for employee use. Check with your IT or HR department to find out what may be available at your company. No matter what type of pain you're experiencing, there are natural solutions for better pain management. Options can include electrical stimulation, massage, acupuncture, and you and your doctor can work together to develop a self-management plan, allowing you to have more control over your pain and your life. The techniques we discussed today include effective pacing, food choices, physical activity, easing tension, sleeping better, focus, positive thoughts, and ergonomics.